Hi, I'm Stephen. I'm one of the vets here at Yorkshire Vets. Today's video is going to be on the clinical exam. Now, as we're chatting away to you during the clinical exam, we're checking so many things without you knowing. So I'm going to take you through everything that we're looking at and all the information we're finding out. A lot of it you can do at your home and get to know about the health of your pet even more. So here we are in the consulting room, but the clinical exam actually starts out in the waiting room for dogs. So when they're walking towards us, we're assessing their movement, we're looking at their front end. As you walk past us, we're looking at their back end, we're looking for any movement issues. We're also looking at how they're acting normally, do they look bright, have they got any issues with their coat. So we're looking to see if they've got a nice, uniform, even coat. We're also looking for things like tear staining on them, and we're looking at things like their feet. They have little brown feet that could indicate they've got allergies. So that all happens just as you're coming in there, and then once we get in there, we start getting our hands on. And for that, I've brought in Rufus and Luna to show you what we do. So I'm here with Rufus now. Now when you're doing a clinical exam, a lot of this you can do at home to look after your own pets as well, check on their health. It doesn't matter how you do it, we do it kind of just chatting away with you, but I'm going to slow it down so you can see. I'm going to start at the head end today, and so first thing we're going to do is look at Rufus's eyes. Are they equal? Pupil size? Are they nice and bright? We can check the third eyelid, make sure it's coming up okay. We can make sure that there's no rolling in eyelids there. We're going to come down to the mouth now, and we're just going to check on his gum colour. It's nice and pink. Now by looking at his gum colour here, we can see sometimes that dogs are anemic, so if they've got white gums, they're anemic. If they've got yellow gums, it could indicate problems in and around the liver. If they've got blue gums, it can suggest that there's a problem with the heart or the lungs. And you can get chocolate coloured gums, and that can be a poisoning. Get really bright red gums as well. So, and then the other thing we do in the mouth is capillary refill. You just press the gum, wait for the colour to come back, and that can give us an idea of things like shock. It can give us an idea of things like circulation. Is the heart pumping around the body well? So we can also, in the mouth region, look at the teeth, have a good look, see if there's any plaque in there, have a look for any problems in the mouth, any lumps or bumps, have a look at the tongue. We can check out his nose, make sure that there's no problems with his nose, everything looks nice and even there. We can then come back and check out his ears. We should have his nice big ear flap here, going down to his canal. That comes down an ear canal to here and then turn inwards, so you can have a feel of the ear canals as well. And then we can come down and have a feel underneath here. We're feeling lymph nodes, which can indicate infection, and we sometimes see tumours there. We can then have a little feel of his larynx, which is where his voice box is, just having a feel that there's no problems associated with that. In cats, we particularly pay attention to the thyroid gland, which you shouldn't be able to feel, but we can sometimes, which it can indicate they've got a thyroid problem. And that's the point that we then normally get our stethoscope out. So then we move back to the chest cavity. It's the thing that everybody sees us doing, and that's getting out the stethoscope. So when we get out the stethoscope, we'll listen to the heart on both sides, because you hear different noises there. We can listen across the full chest cavity up here, and we can also listen to the windpipe. Now listening to the breathing, we'll listen to hear nice clean sounds. We can pick up wheezes, we can pick up rales, which can indicate heart problems. We can pick up dull areas, which can indicate solids in there. And when we're listening to the heart, we're listening to the rate and the rhythm. So we should be hearing the boom noises as the heart valve shut, and then we should hear them nice and regular, that it's not too fast, not too slow, and we've got a nice even beat. From there, we then move back to the abdominal cavity. So when we come down to the abdomen, the smaller an animal is, the more relaxed an animal is, the more we can feel. So in a big fella like Rufus, we can't necessarily feel a great deal, but in a cat you can feel a lot more. So in a cat we'd be able to feel the kidneys up in here. We can then kind of feel down and feel things like the spleen. You'll sometimes, digging under there, feel the liver if it's enlarged. You can come back here and you can feel the intestines. You'll sometimes feel lumps and bumps in there. You can sometimes feel blockages. When we're coming with pregnant girls, we can sometimes feel the little bumps as we come through. In boy dogs, we'll sometimes feel a prostate that's enlarged by pushing in here. And in cats and dogs, we can sometimes feel the bladder by just feeling back here. And once we've done the abdomen, the next port of call is the pulse. Now you can feel a dog's pulse. It runs down there, but on the inside of the leg. It's the same with cats. Have a little feel of that. and it should be pumping away nice and regularly, nice and evenly. We can then come down the back legs and we can feel the popliteal lymph node, which just sits in there, which we get sometimes annoyed with infections and tumours. And we can come down, have a look at the legs, feel the legs. Again, we can do that with the front legs. You can sometimes feel arthritic joints, you can sometimes feel lumps and bumps, but it's all very quickly done and you get a load of information just by going over them. So that's it for the clinical exam. That exam we do with every vaccine, every consult, we're just checking them over. If there's a specific problem, we will do a more in-depth examination. So if it's a lameness exam, we'll be doing flexion tests and we'll be doing specific tests to find out the swelling and pain. If you need any more information, then please put it in the comments box below and we'll get back to you. If you want to watch any more of these videos, then please subscribe to us on Instagram, Twitter, Facebook and at yorkshirevets.co.uk.